Hello, and welcome to today's webinar, Breast Cancer Care in Communities of Color. I am Michelle Dixon, and I am the Program and Development Director for the Massachusetts Breast Cancer Coalition, and I'd like to thank you for joining us today. I'm very pleased to welcome today's speaker, Hope White. Ms. White is a proactive, results-driven public health professional with extensive experience in community-based health programming management and health promotion. Among her numerous accomplishments, she has directed one of the nation's first citywide mobile mammography vans, serving 23 diverse neighborhoods in Boston. Ms. White created, implemented, and directed the first breast cancer support group, Spirit-Wise Sisters, for African American women living in Boston, a program that has been replicated nationally. Most recently, she was the coordinator of breast cancer health, outreach, and education at the Codman Square Health Center, where she provided community-based outreach, breast health education through workshops, presentations, and forums. Ms. White is passionate about creating health equity and leading innovative community health programs that provide education, access to resources, and self-empowerment development for diverse, underrepresented communities. We at MBCC are very proud to have her as a member of our board of directors. Hope, welcome back.
Thank you, Michelle. It's a pleasure to be back. I'm excited about the talk today.
I am too. I've been looking forward to this. So, Hope, my opening, I could barely begin to touch on your vast experience. So if you wouldn't mind just sharing, how long have you been doing this work, and more importantly, why are you still doing it?
Okay. I've actually been in the public health field for over 30 years now, which is quite a long time when you say it out loud. But I came upon this work when I was asked to be a volunteer. A friend of mine was working at the Boston Public Health Commission, and they just got some recent funding to do a citywide breast cancer education program, and they were looking for some women to do some outreach. They didn't have enough funding to pay me, but they said if I come on board as a volunteer, they might get some funding after a few months. And I started doing volunteer work, learned about the basics of breast health and breast cancer, was hired officially after 2 months. 3 months later, I was promoted to coordinator. And then 6 months later, I was appointed as director. And with that title, I was doing breast cancer education and breast health promotion for all of the 21 neighborhoods in the city of Boston, and ended up staying in that job for about 7 years. I've been very passionate about not only breast health, but women's health in general, because communities of color have the highest disparity rates. I'm a woman of color. There are women of color in my family. I have friends. And so this awful statistic is happening to my people and happening to women in my family. So I feel very personal about it, also very passionate about it. And so I said, if there's something that I can do with my work to kind of reverse those awful statistics, that's what I want to commit my life to doing. And so I'm here, and I'm here to stay.
Excellent.
Mm-hmm.
So talk to us a little bit about what trends have you seen? Have you seen progress? I know the statistics are not great, but have you seen progress?
I have seen progress. When I started at the commission many years ago, screening rates for women of color were very low. And so at the time, Mayor Menino said there needs to be some education around it to have women of color get screened. And there also was an issue of accessibility for women of color. So after, I would say, 2 or 3 years being at the commission, the mayor launched the first mobile mammography van I believe, in the country at the time. And this van was able to go into communities of color and into different neighborhoods and bring screening to these women. And over time, at least in Boston, you could see a shift in the numbers of women that are being screened and the number of women who have found to have a positive diagnosis. So that really made a difference. Michelle?
Yes. Can you
Oh,
still?
I can't
Yes.
see you, but I can hear you, but that's okay. As long as you're there.
I am still here. I promise you. We may be having a little glitch with the platform, but we'll keep going.
Okay. So over time, there has been definitely a shift in the amount of Black women and Latinx or Hispanic women that are being screened. Right now, statistics show that white women and women of color are being screened pretty much at the same rate. However, the mortality rates are still the highest for Black women. Over 40% of Black women, the death rates for Black women are 40% higher as opposed to white women. So that's still a huge factor, but the screening rates are now pretty much the same for Black and white women.
So, Hope, what do you think is attributing to the fact that the screening rates are getting better, but the mortality rates aren't?
There are a lot of factors, and what I want to change my screen. Let's see, hold on one second. Okay, maybe I need to go to the next one. Racial disparities in breast cancer care. A lot of factors are attributing to this, and it connects to social determinants of health. There are a lot of factors and barriers and obstacles that are preventing women of color from being screened and for having early diagnosis. I created a list that you'll see on the screen. And so racism is now a very prominent public health issue. Racism is branching off into many areas and has been proven to be barriers for women of color and Latinx women for getting the proper health care. Environment is a factor. Women living in poverty, women not having health insurance or having access to good health care, women who have lack of health insurance. A lot of these women also don't have social support, like friends and family to help them. These women typically have children or older women, and oftentimes are also raising their grandchildren. And so they don't have childcare to help them so they can go get screened, or they have no transportation to get down to the hospital or to the health center. So there are a lot of factors that are very prevalent that is preventing women from getting good breast cancer care and breast health care.
Can you talk a little bit more about the impact of racism and the differences in terms of how not only access, but the actual approach medical professionals are taking with women of color?
Okay. Well, in my work, I have had many stories told by women to me that they have felt discriminated against while going to the doctors. For an example, they would arrive for an appointment, they would be on time, they would be asked to wait, and other women would come in, white women, and would be chosen over them. They were all in the mammography suite in the mammography suite ready to have their mammogram. And so the Black woman would say, well, I'm here on time, I'm waiting, yet someone comes in after me who's not of color and is taken. And so with negative incidences like that, when the women have said, well, I'm not going back to that place because, you know, they don't care about me. I'm overlooked, I'm being discriminated against. I've had stories where women are in the examining room and the doctor comes in. The woman isn't addressed. She's not greeted. The doctor doesn't even look at her in the face and just proceeds to examine her and touch her. And so that kind of behavior is rude, is cold. And women, again, have expressed that, you know, why should I go? Why should I be treated as less than? I don't like how I feel when I'm in those situations. And so I'm not going to return. So when I do my education, not only am I talking about the basic facts and information about breast health regarding early detection methods or screening information, but I'm dealing with an emotional piece where women have really felt that they've been hurt. And that hurt and that feeling of being ignored has prevented women from going back. And so that's a process, and that takes time to kind of change that mindset. And I've experienced similar treatment as well. And you know, this is my field. I'm an educated woman, and you know, I've had some of the same experiences. So that's hard, and it's very painful.
Absolutely. Absolutely. So obviously, there's only, you know, you can have the conversation with the community, but what about the medical profession?
Well, that's a hard group to reach. In my work, we had created certain brochures and pamphlets that we were able to leave in certain mammography suites at certain hospitals. And some of the material were geared towards doctors and behavior, saying, you know, every woman is a person, take time to get to know this woman, and really listen. Women always talk about not being heard. You know, there's been women that I've worked with that had said that they felt something. They had a mammogram, nothing showed up on the mammogram, and the doctor just dismissed them. And later on, the lump got larger and then was shown on the mammogram. What I've said to different colleagues who are doctors is take the time to listen to this woman. A woman really knows her body, and sometimes things aren't detectable right away, but really take some stock in what she's saying. There's more than one way to be screened. Doing a self-exam or having a doctor do a clinical exam, all of those ways are still effective. So with my medical colleagues, I just say, make a woman feel like she's important, make her feel like her voice is heard, and really validate what she's saying. But it's a process. You know, that doctor schedules are overwhelming, they're packed full, and so they don't literally have a lot of time to engage. But the time that you do have, you want to make the best of it. You want to give your full attention to your patient or to the woman, and really make her feel important. That's important.
Mm-hmm. And Hope, what about younger women, teens, giving them the tools and the knowledge early on so that as they get older, as they move through life, and they know not only about screening, but also, as you know so well, you know, MBCC's mission is all about prevention. What kind of education and messaging do we need there?
Okay. I am definitely all about educating teens about their bodies and its function very early on. With my work and by the American Cancer Society's guidelines, by the time a young woman is 20, she should start doing her own breast self-exam, getting familiar with her breasts, um, getting familiar, how they look and how they feel, and also talk to your mom or your grandma or your aunt about the history of breast cancer in your family. Not only breast cancer, but other illnesses. There really seems to be a gap with family history. A lot of women that I encounter aren't familiar with medical history in their family. They don't know what their grandmother died of or their great grandmother died of. They don't know if they're at risk of cancer or, diabetes or hypertension. So I tell the young women to learn your family history, talk to your mom, but to also know your body. Today, a lot of young women are sexually active. And so if I encounter young women who are sexually engaged, I say you should also be examining your breasts. You want to make sure, that all of your body is healthy, that you go for your regular pap smears. And then if you have no history of cancer, you want to start getting your mammograms by the time you're 40. If there is a history of cancer, you can get your mammogram before then. But education and open communication is very key for the young women.
So, Hope, what do you want to see? How do organizations like MBCC and other community groups, how do we best help? How do we best engage to not only support women of color, but also engage the medical community, just in general, in terms of helping to make sure that we minimize these disparities, that women of color are provided with the information that they need, and supported as they move through, the process of interacting with, not only medical professionals, but in their work environments from a preventative nature in terms of exposure to chemicals, the potential in the products that they buy.
Mm-hmm.
What can we do? What should we be doing?
Well, I already know that we offer community-based workshops that talks about environmental factors and talks about how to do some basic things within your home to lessen your exposure. Using less chemicals or using chemical-free things to clean your house, leaving your shoes outside of your house so you don't bring in the pollution and dirt that you've accumulated on your shoes. So awareness is very important. Taking this information to neighborhoods of color, doing speaking engagements, maybe at some of the churches, where there's a huge population of women of color. And you know that if the pastor okays something, then it must be great. Even doing education at schools, at health centers, and even offering community forums where you can engage people and have them ask questions. I've noticed that within the last few years, in neighborhoods of color, they're offering more things that are environmentally friendly. They're having, what do you call them? The healthy food stands and fruit stands during the warm weather, where you can buy chemical-free produce and chemical-free items. And so my community is really catching on that there's different things that you can do that aren't expensive to lower your risk and exposure to carcinogens. As far as hitting the medical community, things like I'm doing now, webinars, talking about it. Hopefully, different doctors and clinicians can be present to hear. But again, speaking to groups of people. I know that hospitals have sometimes what they call lunchtime information sessions, where you go and present while doctors or nurses are having lunch. It's a lot of ground to cover, and so I've had the idea that you have to kind of take it step by step and group by group. And you know that when you share information with one group, people within that group will take it back to their homes, take it back to their churches, take it back to their residences, and it kind of passes on that way. MBCC has been very committed in enlightening people about environmental factors and the connection to breast cancer. And so the work that we do, you know, continues. There's still a lot to be done.
Yes, yes, there is.
Mm-hmm.
What about policy changes?
Well, one thing that sticks out in my mind, because a lot of women of color, Black, Hispanic, and Latinx, a lot of women are still not health insured. I believe in the country, currently 51% of women of color, that includes Black, Hispanic, and also Indigenous women, 51% do not have health insurance in 2020 and 2021, which is a lot. That's high. So my biggest policy change would be to make sure all women are covered, to possibly expand Medicaid and make it more inclusive and easier to access would be huge. Women who do not have health insurance will not go for a mammogram, or will not go for a pap test, or will not go for a basic annual checkup. And so not having health insurance prevents a lot of things. So my biggest policy change is that women, all women, are covered. Some of the guidelines or the restrictions have to be loosened to be more inclusive, but that would be a huge change that would affect all women's health, not just breast health.
And I hope, I know we've talked about this before and when you were preparing for this presentation, but what about the research? I know that as you were looking for statistics and information, there were some groups that just weren't covered.
Correct. Since Black women have the highest mortality rate, we are also the smallest group that are involved in clinical trials. I worked with an organization for a little while that had some funding for clinical trials education in communities of color. And similar to what I did with breast health, we would have different groups of women from different neighborhoods, and we would gather together and I would talk to them about clinical trials. Even today, there are still myths and untruths about clinical trials. You know, as you know, Michelle, we have a negative history where we were used as guinea pigs and were abused in the name of clinical trials, and that history is still very prevalent in women's minds. And so they don't understand that clinical trials are safe today, that they're monitored, that there are all different things that protect them from being taken advantage of. Doctors have said that research is not as advanced for women of color because they don't participate in the trials. And so when I do my breast cancer and breast health education, I talk about the importance of participating in trials, that it is okay, and that you will not gain any ground with addressing our disparity and mortality issues unless we participate.
Is there a difference in the participation among Hispanic women, Latinx, than there is with Black women?
There is no difference. The participation for all of those groups are extremely low. Like I mentioned, Black women have a higher mortality rate, but Latinx women die from breast cancer as well. And so we need participation from Latinx, Hispanic, Black, even indigenous groups. All you can do is educate. Like I had mentioned, it's hard to change mindsets, it's hard to change behaviors. But especially in the African American community, our women are dying. And so participation is crucial. I mean, that's a factor. I don't know, how better to say it. We need to do it. We need to do it.
What is something that you want our audience to know that we haven't talked about?
I mean, the disparity is great. It's great, and because I am a woman of color, it's sad. It's sad to see that my sisters are dying more than any other group. We have to get more involved, and we have to make it a point of educating ourselves, especially coming from Boston or living in Boston or Massachusetts, where we are the medical hub of the country or even the world. Women of color are still outside of the healthcare system, where we have tons of hospitals, tons of community health centers, different types of insurances, Mass Health and Commonwealth Care, and still with all of that in front of us, it is not fully being utilized by women of color. And so it's frustrating to see. As I said, it's sad to see. And so, that education that I do and the education that my programs do is just consistent. I mean, I've seen success stories. I've seen women who have had screenings and the breast cancer was caught at an early stage, so intervention was possible. But I've seen women that have had, a breast cancer lump, literally as big as a bowling ball, where she had to wear capes because the tumor was so big she couldn't put her arm down. And she refused to go to the doctor. After she was diagnosed, she said, that's it. I don't want any intervention. I don't want any treatment. And so it goes from one gamut to the other. It's hard. It's just hard. It's hard to even think about because it's sad and you see it and you feel for these women, you get frustrated. But women have to want to make the change. Though we talked about racism being a factor, but not everyone is racist. And if you need someone to go to the doctor with you as support, that can happen. If you feel that you're discriminated against, you have the right to talk to the head of that department. You can make a call, you can send a letter. With my work, I also do a lot of empowerment because women think that, what the doctor says is God and they just come in, follow, and they may not even understand what is being transpired to them. So they'll leave the doctor's office not understanding the directions or understanding the medication, but they won't speak up. And I say, you have the right. This is your body. If you don't understand, you ask. Can you tell me that again? Can you repeat that? Can you write that down for me? So being a self-advocate is also part of the issue. But women don't feel that they have the right to speak up and to answer, or rather to ask questions. So it's a lot at hand. It's a lot.
We had a question that came in just now. Someone asked, as a white woman, what can she do as an ally to support and to help in this effort?
Okay, good question. Well, if she has any friends or colleagues who are women of color, I would check in with them. Women always talk to each other about, the latest fashion. Do you have the latest shoes? Or have you hit the latest restaurant? You should say, well, have you had your mammogram this year? Where do you go for your mammogram? Or what's your doctor like? We have to learn to talk about our health. I know that a lot of people are very private. You know, in my family, it's like, oh, you don't talk about that, or, people die and you don't even know what they died from. You just know that, Aunt Mary died. Okay, that's it. But amongst your
there's
friends,
a stigma with it, and it's how do you get people past that stigma to talk about it?
absolutely. All I can say is talk about it more and keep talking until it becomes comfortable. You know, check in with your girlfriends and your colleagues about, their screening. You don't have to know details, but there was a time when I needed a doctor, and so I asked people, who's your gynecologist, and what is she like, or what is he like, and they say, oh, he's nice, he'll talk to you. I'm like, okay, maybe I'll check him out. But open communication is key. We have to talk about things. That's how you learn. And that's how you know, which gives you insight to different things. And so, for women who are white, definitely talk about it, ask questions, participate in things in communities of color. They still have, well, because of COVID, but I was going to say, and they have different awareness events, fundraising events, which connects to all women. So participate in breast cancer walks or breast cancer talks, and check in with women of color and kind of see where they're at. You can never have too many allies,
This is true. This is true.
Yes.
Another question, Hope, that's come in is from an African American woman who's asking, is there an opportunity to access doctors of color? And is there a vehicle to find, a doctor that looks like me, essentially?
There is, and there is something online. If you put in doctors of color in Massachusetts, a list will be presented to you. And you can be specific as to the type of doctor. So Black neurologists in Massachusetts, Black oncologists. It's right at your fingertips. So Google it, and a list will be available to you. Yeah, I've asked that question. I've had that question asked many times. But yes, it's all on the internet. All on the internet.
And while we know that it's not a given that the background of your doctor is going to guarantee you better care or different type of care, there is a comfort level. There is a comfort level.
And there's a connection.
It's one more way to get past that initial hurdle of even showing up.
Absolutely. Yes.
Excellent. Well, Hope, we've covered a lot, and I think the importance of the work that you're doing, the education, the communication, the empowerment is so important.
It is.
And I am hoping that MBCC is playing a role in that through our Let's Talk Prevention program, and with our student education program now with the free modules that we're offering to students in elementary, middle, and high school to communicate about, the impacts of chemicals and the importance of prevention and knowing about your own health.
Exactly.
I'm hoping that we're making a small difference there as well.
Big difference.
A big difference.
A big difference.
And, we need to keep having these conversations.
We do. Until I see the disparity rates decreasing, I'm going to stay as vocal as I can and keep educating and keep shedding awareness. The last year there's been a lot of attention regarding racism and systemic racism. And so all of that trickles down to health. As we talked about, there is a connection to racism and lack of efficient healthcare for people of color. And so we have to keep fighting. I mean, we saw a milestone happen a couple of days ago, something we all, well, at least me, never imagined would happen. And so there's still hope. And there's still time to change and make things better. So as I continue to do my work, I just want to inspire women, let them know that you have a voice, kind of give them tips on how to empower themselves, and then they can be their own advocates. If you keep talking enough, people will listen. And so that's my advice.
Thank you, Hope. Thank you very much for this time.
Thank you so much.
I want to say on behalf of Cheryl Osimo, our executive director, who is such a fan of yours and so proud of all of the work that you do and that you are a part of our board and our board of directors. Thank you very much for taking some time to talk about this, for the work that you do. I hope that you will come back and spend some time with us again, because I really do enjoy these conversations.
Thank you.
And I want to thank everyone who joined us today on this call. And for those who are interested in the recording, I'm already getting a couple of questions asking when it'll be up on the website. It will be up later this afternoon. And with that, I want to say thank you, and I wish you all a very good afternoon.
Thank you, Michelle.
Take care. Be well. Thank you, Hope. Bye-bye.
Have a good day.